I'm a research fellow in the School of Health and Psychological Sciences. And my background is in child and adolescent mental health research. Yeah, I've done a lot of work with children, like vulnerable children who are looked after in the care system. But more recent times, I've been more working with the professionals who support children's mental health. It was funded by the city's School of Health and Psychological Sciences pump priming scheme. So we got a small amount of money to work with a large all-through school in London. So they've got a primary, secondary, and a sixth form phase. They're a really big school. They've got like 1,800 students. And the project was to co-design a whole school solution-focused program to improve student and staff mental well-being. We were approached by the safeguarding lead at the school a few years ago now, probably about 3 years ago, and they were quite concerned about the levels of like rising levels of mental health problems among students and the stress on staff, particularly post-pandemic. And they were interested in new ways of embedding mental health support in the school. So we have experience in our department of using brief solution-focused interventions, which are quite a paradigm shift from sort of more traditional therapeutic approaches. So they're strength-based approaches, like looking at people's skills and resources and how they can work towards what they'd like to achieve in future. The more we spoke to students and staff, and we ran sessions with parents too, the more we realized that actually it was more about sort of altering the culture of the school, and moving it from a kind of punitive, like discipline-based model to more of a strength-based model, and how that would then have a knock-on effect on so many things. So improving communication in students and staff, improving communication with staff and parents,